Hi, I'm Kylie. I'm from Direct Performance Physical Therapy, and I'm here to talk about temporomandibular joint dysfunction, appropriately referred to as TMD. It's uncommonly and mistakenly referred to as TMJ. This is a classification of pain that falls under many umbrellas when you have pain in the area around the temporomandibular joint. It can be caused by a couple different things that we'll get into later, but first I wanted to talk about the anatomy. So for the anatomy of the temporomandibular joint, you have a condyle at the top of your mandibular bone, and that sits up in the top of your skull bone in the maxilla. There's a little fossa, and then what creates the congruency between the mandibular condyle and the maxillary fossa is a bi-concave disc. This disc is avascular, so whenever people are experiencing pain in that region, that doesn't mean that the disc is being irritated. It's actually the retrodiscal tissue, which is the muscles behind that are innervated by nerves and blood supply. So that's an important thing to consider. Next, the anatomy. Whenever we're having TMJ pain, TMD, see, I make a mistake too. It's actually pain that can be caused by the muscles that do the job of closing the mouth. So if you think of your masseter muscle that goes from your zygomatic arch on the cheekbone here down to the mandible, that's a common area or a source of pain, as well as the temporalis, which is up in the skull. So your temporalis and your masseter work together to clench, and that's something we want to do when we chew our food, but we don't want to be clenching all the time. And if you clench, you can feel that muscle pop out. Okay, so there's some other muscles too that can be also sources of pain. You have your medial and lateral pterygoids, which act to open and stabilize the temporomandibular joint. And then you have a hyoid muscles under the jaw here too, but those typically aren't as big of a referral source. Whenever we're treating the muscles, if it's myofascial, like muscle-related TMJ pain, there's a couple different things we can do to relax the muscles, such as stretching, dry needling the muscles, using exercises to retrain the muscles, and heat and cold. We tell people heat and cold, whichever is more preferential to you. There's no research that supports one over the other.